Clinical Scenario 1. A 40-year-old obese patient with a sedentary lifestyle presents with acute right lower quadrant pain, nausea, and vomiting. On physical examination, there is tenderness in the right lower quadrant. What is the most likely diagnosis? A. Appendicitis. B. Diverticulitis. C. Inguinal hernia. D. Gastroenteritis. Answer A. Appendicitis. Explanation: this patient's presentation of acute right lower quadrant pain, tenderness, and nausea/vomiting is highly suggestive of appendicitis, which is a surgical emergency. Clinical Scenario 2. A 65-year-old female presents with duodenophagia and dysphagia to solids. Upper endoscopy reveals linear furrows and white plaques in the esophagus. What is the most likely diagnosis? A. Eosinophilic esophagitis. B. Gastroesophageal reflux disease, GERDC, esophageal candidiasis. D. Barrett's esophagus. Answer A. Eosinophilic esophagitis. Explanation: the patient's symptoms, endoscopic findings of linear furrows and white plaques in the esophagus, are characteristic of eosinophilic esophagitis. Clinical Scenario 3. A 50-year-old patient with a history of peptic ulcer disease is found to have a bleeding duodenal ulcer during upper endoscopy. What is the initial management step? A. Immediate surgery. B. Endoscopic hemostasis. C. Proton pump inhibitor PPI therapy. D. Blood transfusion. Answer B. Endoscopic hemostasis. Explanation: the initial management of a bleeding duodenal ulcer is endoscopic hemostasis, which can include techniques like injection of epinephrine, thermal therapy, or application of hemostatic clips. Surgery is reserved for cases not responsive to endoscopy. Clinical Scenario 4. A patient with chronic hepatitis B infection has elevated liver enzymes and a high viral load. What is the most appropriate management? A. Start antiviral therapy. B. Liver biopsy. C. Hepatitis B vaccination. D. Lifestyle modification. Answer A. Start antiviral therapy. Explanation: in patients with chronic hepatitis B infection, antiviral therapy is indicated if they have elevated liver enzymes and a high viral load, as it can reduce the risk of liver disease progression. Clinical Scenario 5. A 35-year-old patient with a history of irritable bowel syndrome, IBS, presents with diarrhea predominant symptoms that do not respond to dietary modification. What is the next step in management? A. Colonoscopy. B. High-fiber diet. C. Antispasmodic medication. D. Stool culture. Answer A. Colonoscopy. Explanation: in patients with IBS who present with alarm features or symptoms not responding to initial management, a colonoscopy is indicated to rule out other potential causes of gastrointestinal symptoms, such as inflammatory bowel disease, IBD, or colorectal cancer. Clinical Scenario 6. A 60-year-old patient with a history of alcohol abuse presents with acute pancreatitis. What is the most important initial management step? A. Intravenous fluids. B. Antibiotics. C. Bowel rest. D. Proton pump inhibitors, PPIs. Answer A. Intravenous fluids. Explanation: in managing acute pancreatitis, the most important initial step is to provide intravenous fluids for volume resuscitation and correction of dehydration. Clinical Scenario 7. A 45-year-old patient is diagnosed with celiac disease based on serologic testing and duodenal biopsy. What is the mainstay of treatment? A. Antibiotics. B. Gluten-free diet. C. Immunosuppressive therapy. D. Proton pump inhibitors, PPIs. Answer B. Gluten-free diet. Explanation: the mainstay of treatment for celiac disease is a strict gluten-free diet, which helps alleviate symptoms and prevent complications. Clinical Scenario 8. A 55-year-old male with a history of chronic hepatitis C infection presents with decompensated cirrhosis and ascites. What is the first-line treatment for ascites in this patient? A. Diuretics, spironolactone and furosemide. B. Paracentesis. C. Liver transplantation. D. Transjugular intrahepatic portosystemic shunt, TIPS. Answer A. Diuretics, spironolactone and furosemide. Explanation. The first-line treatment for ascites in patients with cirrhosis is diuretic therapy with a combination of spironolactone and furosemide. Clinical scenario 9. A 40-year-old patient with known gastroesophageal reflux disease, GERD, continues to have symptoms despite proton pump inhibitor, PPI, therapy. What is the next step in management? A. Increase the PPI dose. B. Add an H2 receptor antagonist. C. Refer for Nissen fundoplication surgery. D. Perform esophageal pH monitoring. Answer D. Perform esophageal pH monitoring. Explanation. In patients with persistent GERD symptoms despite PPI therapy, esophageal pH monitoring is indicated to assess the degree of acid reflux and guide further management. Clinical scenario 10. A 30-year-old patient with a history of inflammatory bowel disease, IBD, presents with a flare-up of symptoms. What is the initial treatment approach? A. Start corticosteroids. B. Begin immunomodulator therapy. C. Surgical resection. D. High-fiber diet. Answer A. Start corticosteroids. Explanation. In the management of IBD flare-ups, the initial treatment approach typically involves corticosteroids to induce remission.